When I did find out I had cancer, I had the typical diet of the typical American, hamburgers, red meat, sugar, whatever, the typical diet, and I want a very, very strict diet. No sugar, no processed food, no red meat, no soda, no wine, no alcohol. Extremely strict diet.
Was it hard for you to change?
For the first 2 weeks, it was incredibly hard. Nothing tasted good. I didn't have any, I wasn't hungry. One of the things that helped me a lot was my wife did it with me. And so we both pretty much went through 2 weeks of not liking what we were eating. And sure enough, after a little while, it got to the point where I got used to it. And it was delicious. And I'm sure if I went to the other way that I used to eat, it probably would be very foreign tasting, be very salty, a lot of sugar. So I was trying to go for a healthy lifestyle, figuring I'll get myself as healthy as possible. When I have to deal with the prostate cancer, whether it's surgery or something else, I'll try to be as healthy as I could.
Do you think that it pays for that?
Yes. I think that was probably a big part of me getting healthy.
Can you describe how the hyperthermia treatments in conjunction with low-dose radiation that you receive? So let's say some person that doesn't know what is it like. You can explain it very briefly.
Okay. Basically with me, I had 2 treatments of hyperthermia every day. And it's pretty much where you have heat applied directly to an area where your tumors are. And for 45 minutes, 45 minutes.
Is it uncomfortable?
No, you're laying in a bed. It's not uncomfortable. It can get warm. And sometimes, every time, they give you a bell. You ring the bell and someone is there instantly to help you make sure you're comfortable. So I was never by myself thinking that nobody was taking care of me.
So in the 2 treatments, how long did it take for the 2 treatments?
2 treatments was probably about an hour and a half.
Okay.
And then from there, a radiation. And radiation was probably, by the time you go there and wait and do your treatment, it's about a half hour.
For how long did you do the treatment? Did you receive the treatment?
Almost 5 months.
Almost 5 months. It was a long journey. But do you live in the area? Or?
I live 2.5 hours away in Orange County, so I drove every day.
Every day?
Yeah.
So you were able to keep your normal life? Working?
I didn't work because I was going to try to go back to my job. And I tried for 2 weeks, but the radiation made me tired in the very beginning. Just the whole change of my life, coming here, the hours spent driving back home, it made me tired. So I felt that I probably should just go on disability, focus all my attention to getting healthy.
That's a good wise decision.
And it less stress. I could really concentrate on making it here every day. I didn't skip any days. Yeah, I wanted to make sure that I gave this 100% shot.
And that's a very wise decision because health is the most important thing that you
Well,
have.
if you figure it this way, sometimes you feel good, even though you might not be. And so when the doctors are telling you to do something, they know more than me. Even though I might be feeling great, if they're telling me to do something, I'm going to follow it through.
That's great. Do you have any side effects?
Right now, because I'm still on a treatment, I go off, tomorrow's my last day. Urinating can kind of be a little troublesome, but they give you pills for it and it's not a big deal.
These side effects will last or will be resolved?
It'll go away. Yeah, it'll go away. Other than any other side effects, to be honest with you, in the very beginning, the first month is the most difficult because the radiation, you're getting radiation in your body, the hyperthermia, a lot of different things. Your body just goes through changes, because they've told me that when you have hyperthermia and radiation, the area that they're working on will swell. And so that makes you feel different too. But then you adjust to it, and then things start to reduce, and then you're on your way to getting better.